Welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
I'm Dr. Lynn Hierlihy.
Doctor, apparently.
Doctor, this is our first PhD doctor and medical doctor on the show.
Dr. Hierlihy, you are a pediatrician by training, and you have a PhD in?
Neurophysiology. Yeah.
And you work in a clinic that diagnoses and treats ADHD?
Yeah, we do full assessments for ADHD. We also do psychoeducation assessments, but I'm a pediatrician and yes, work at Springboard Clinic in Toronto.
Well, thank you so much for joining us today.
My pleasure.
And what are you going to be talking about today?
ADHD.
Okay, so Attention Deficit Hyperactivity Disorder, ADHD.
Oh, gosh, when you say it like that, I don't like it. You know, I know it's a disorder.
Sure.
It's a difference.
Okay,
yes. I don't want to minimize symptoms, but you know, attention deficit makes it sound.
Yeah, like negative.
Okay.
Negative.
For sure.
I know.
So,
I looked up the history of medicine. Did you know that the first time anyone ever talked about this was a guy named Sir Alexander Crichton? In 1798, he described a series of symptoms in people that really, when they look back, said, this guy was talking about ADHD. Way back in the late 1700s. I thought it was pretty impressive.
a little bit of history of Paul Zalzal. In preparation for this,
Okay.
I took a self-ADHD assessment test
Nice.
online yesterday.
How'd that go?
Well, it took me 3 tries because I kept getting distracted. However, turns out I was at a moderate risk. So
Not
I ended up coming
surprised.
to
I could have
see you.
predicted that. Yeah, I could have predicted that.
I answered it.
surprised.
I did it again and answered it as if I was Brad Wiening, and I came off the charts. Really.
That's not impossible either. Okay, so
There's a lot of very high functioning ADHD.
and that's good to know. We're going to talk about that. So like all the disorders that we talk about, or issues or conditions or whatever we want to name them, how do people come to the conclusion that maybe I might have this? Like, what kind of signs or symptoms would a parent, a child, or an adult for that matter, recognize in themselves and say, you know, maybe I need to talk to somebody about this?
Well, often it's like starting something new, like in life. You're starting school, starting high school, transition, leaving home for the first time, like
Right.
going off to university. Like you leave your frontal lobe at home because your parents have been that frontal lobe that's helped you organize, prioritize, and plan, right? So all of a sudden you're on your own. You're not getting up at the same time every day. You're, you know, having to go to different places for your classes. In elementary school, it's like you have to start sitting still for the first time in a long time and sit and read. And things just get harder along the way. So the symptoms and the signs, they're always there. It's just they may show up differently depending on where you are in your life.
So what is it? What is the hallmark of ADHD?
Core symptoms are inattention, hyperactivity, impulsivity. Home.
Okay, so you think you may have ADHD, or your child, or your sibling, or something. How do you approach it? What do you do?
What do you do? Well, first of all, talk to someone. Go to your doctor, your therapist, whoever, or other people that you may know that have it. There's quite an online community as well. But be careful of your resources. There are excellent resources online, and there are some not so great resources online.
Like
Yeah,
everything, not even just medicine, just everywhere with the internet, for sure. So okay, so now you've made your first
But
contact.
be your own advocate, because
Okay.
the first person you may talk to, like sadly, a lot of medical doctors haven't had a lot of training in ADHD. So they're, be your own advocate. If you're not getting the answers you need, like they should at least be able to point you in the right direction within your community.
Okay, so you've gone to your family doctor. What are they going to do? How are they going to assess you to see if you have ADHD, or your sibling, or your child?
You know what? It really depends on their level of experience and expertise. Doing an ADHD diagnosis or assessment, which looks at the context of the diagnosis within their life. So it looks at everything, how they're doing in school, how they're doing in their relationships, what are their resources, what's the family, what's the environment. But the diagnosis is a set of criteria. It's based on a set of criteria. There's 18. I'm
You're good.
babbling again.
You're
okay.
fine.
So there's 2 groups of 9 symptoms. So there's 9 in the inattentive category. There's 9 in the hyperactive, impulsive sort of category, and you need to have a certain number of symptoms in each category, or one or the other, depending on which presentation of ADHD you have. But it's more than that, because it's consistent, it's persistent, it's pervasive, and most of all, it's impairing. So it's not just once in a while, it's 24/7, it's every day. It's not, it just didn't come out of the blue, it's been there forever. It's just manifest differently depending on where you are in your lifespan.
And that makes sense, right?
And it's in more than one sort of domain. You know, it's at
School,
home and
work,
at school.
relationship. Okay, so you've got these symptoms. Someone's looked at your sense of your life and said, "Yep." They maybe get you to do a screening test of some sort.
Yeah, so the screening tests are great because you know, sometimes they can be, you know, they're not diagnostic. They're really helpful. They can be metrics as well, so help us follow how people are doing. And it, you know, a lot of the questionnaires we also use. Yes, it's a little bit of homework when you go to get a diagnosis, because we also can get questionnaires from parents and from teachers, because they know the patient quite well. They see them.
Okay.
And they can report on these things, because we need that collateral as well.
Okay, so you think you have it, you go to your family doctor or someone who's going to assess you, and you get a questionnaire to look if you have one of the, to look at if you have a certain number of these criteria, these 2 groups of 9 criteria, and not only do you just have them in a fleeting moment, but you've had these for a long period of time to the point where it's impairing you, and it affects you in different aspects of your life. Is that fair to say?
So that's sort of why it can sometimes be hard to find someone that can do that diagnosis and assessment, because it's very time consuming, and a lot of doctors don't have that time in their practice, or as I said, they're just not experienced, because sadly it's not well taught in medical school. We're rectifying that. I think, you know, it's the same with residencies.
So a family doc might refer you on then to get assessed.
Yeah.
Okay. Fair enough. Okay. So you've been assessed.
Yep.
And looks like you do have features that are consistent with ADHD. What next?
So if they confirm diagnosis, I think first, you know, you come up with a treatment plan, and together with your doctor, your psychologist, your treatment, your diagnostic, your team, and it should be multimodal, and that it will include education, medication, perhaps behavioral treatment, depending on the age and stage of life, maybe some therapy, coaching, because there's a lot of, even if we treat the core symptoms, there's still a whole lot of, you know, issues with executive functions. You know, there's a lot of comorbidities. ADHD is, you know, loves company. There's a lot of other things that might have developed over the years. There's a
what do you mean it loves company? It loves throwing parties and having friends over, or other things going on?
That too. Other things going on. You know, when you think about it, well, we know there's an increased risk, increased association with, like, say, learning disabilities, anxiety, depression, you know, difficulties with social relationships.
Now, question though, could you not say that maybe those things happen because you have untreated ADHD? Like, I think if I couldn't get all my stuff done, I probably would be anxious, and I might be depressed, and I might have trouble organizing my life with my girlfriend or my boyfriend or whoever, or being a good kid for my parents. Like, maybe my room's messy now, but now that makes me sad because my parents are mad. So it feels like it's like
chicken or egg.
It's all related, I would think.
And that's why it can be tricky to
complicated.
tease out what's driving what. And so we look at what's most impairing, and we'll target our treatment to that first. But I love that you brought that up, because a lot of people with ADHD that may not recognize they have ADHD, or they do recognize they have ADHD, they do feel bad. They're redirected. As kids, they're redirected all the time. They're late, they're forgetting things, and so they feel bad, and they're sometimes unfortunately told that you're lazy, you're not trying.
Yes.
So yeah, it takes a big toll on their self-esteem, and it affects them in other areas of their life.
Is it always kids, or can you get it diagnosed as an adult?
Great question. You know, the average age of diagnosis is now probably like 39.
Holy.
Yeah.
Wow.
Yeah.
That
So traditionally,
for me, but
no, it's always useful to explore diagnosis. It doesn't matter what age. It's life changing. to get a diagnosis and to get proper support and treatment.
And probably liberating a little bit. Like you say, thank goodness, you know what I mean? Now I'm doing whatever, I'm doing behavior therapy, you're taking some medication. Now I feel like I can stay on task. I feel like I can be more successful. I'm like, weight is lifted off probably.
Yeah, it's life changing.
Yeah.
And it's, you know, and in medicine there's you know, there's few things that are as satisfying when you can really, I mean, you guys get to fix broken bones and but you know what, they really do well. When you get a diagnosis of ADHD and you get proper support and treatment, it's as you say, liberating. It's like new life. I mean, you can also go through a grief period as an adult too, because you think, what if, but you really got to think of the what is now, and what can I do?
Good news. So it's treatable.
And treatment typically, I'm assuming, would be lifelong, not exactly the same treatment all the time. It probably can evolve over time, but this is not something that you cure per se, you manage.
Great point. It is not something that is cured.
It's like high blood pressure. Right? You know what I mean? Really, we don't ever cure anyone's high blood pressure, it seems, with medication typically. We usually just lower it to a level that we're happy with, and they continue to have.
What's the effect size of blood pressure medication? Do you guys know? You know that ratio of looking at.
Oh yeah, a number needed to treat. You mean?
Yeah, well, number needed to treat is another metric, but you know how it compares to another treatment.
Don't know the answer to that.
Yeah, because I think a lot of the medicine we use are like. They're moderate, so they're like 0.5. Like they use a number of 0.5. But if it's mild, it's like 0.2.
Yeah.
You know what the effect size is for medications such as stimulants that we use for ADHD?
No.
It's hardly seen in medicine. It's like 0.9 to 1.1.
So very
That's
effective.
a really high effect size, which is yeah.
So on the medications, is there one medication, two medications, or a broad class of medications? If you could dumb it down for two orthopedic surgeons to understand, like just overview.
That was fun. Overview. Medications are highly effective. There are the two main classes. We got the stimulants and we have non-stimulants. First line treatment is stimulants. Why? Because they work, and they work well in the majority of people. Non-stimulants can work. They don't work in as many people. So we start with the stimulants. The other thing with stimulants is they work the day you take them. You may have to start, you should always start low and go slow. But you will notice a difference, very soon. But within the stimulants, there's two families, so two classes. So we have the methylphenidate family, we have the amphetamine family, and within those two families, we have a number of medications that we can use. Depending on what country you live in, there might be more than others, but they're just packaged differently.
Okay. And why we as orthopedic surgeons, why we thought we got to, do a video on this one, because it's ADHD Awareness Month.
Yep.
And two, because in our fracture clinics, when we take a history, we do find a lot of the people that in our fracture clinics have ADHD as one of their medical. Is that a thing? Like just injuring yourself more often?
Oh yeah. The hyperactivity, impulsivity leads to multiple visits to the emerge. A lot of could be broken bones. It's sort of part of the history that I would always take, and often that's when the parent says, "Oh yeah, I was known for."
Okay.
And all joking aside, we have talked with each other about whether or not we maybe do have some traits or some degree of ADHD for sure. But yeah, when we were growing up, it just was a less common thing. It's just the way that it was.
Yeah.
Well, think about it. Like the diagnostic statistical manual, the DSM that we use for classifying disorders and mental health, like didn't even mention it early on, and it really wasn't until the most recent one in 2013 that really made these clear sort of presentations, and so it's and the treatment plans and guidelines have really evolved over the last 2 decades. Like it's still relatively new, and that's why, as I said, sadly, a lot of physicians may not have had the training in this because it was before their training, right?
Okay.
But I love that you brought that up, because you can be highly successful. A lot of people think, oh, they're dumb, they're lazy, they're never going to amount to anything. But there's actually studies that show that quite a few people with ADHD have higher than average IQs, but you can do anything you want with ADHD, especially if it's, as I said, treated, properly managed. And often they find careers that suit their
race car driver.
Yeah.
Oh my gosh. Well, I often use that even analogy for younger kids, that you have a race car brain. Like you have a really powerful, amazingly, fast, but also it's capable of so much, but you just don't have the brakes. And
That's a
need
good
to
way to
fine-tune the
describe it.
brakes. Yeah.
Beautiful. Okay,
Yeah.
so it has a happy ending.
Yeah.
Can we summarize real quick here? So you think you might have ADHD, you go
Yep.
talk to someone about it, right?
Yep.
And not everyone is perfectly trained in this, fair enough. The hallmark of ADHD is the 3 core symptoms: hyperactivity, attention deficit, impulsivity.
Yeah.
You're going to get referred somewhere to get assessed, and it's a group of 18 symptoms broken up into 2 groups of 9 on the assessment test.
Yeah, but there's more stuff too that may
Okay.
just not be part of the diagnostic criteria
Sure.
that we're going to also.
Okay, look at those and other things. And then treatment for it is, first thing is be aware that you have it. A multimodal treatment, including behavioral therapy, cognitive therapy, and pharmacotherapy. Education.
Yeah.
Yeah. Okay.
Coaching.
And the good news is treatment is very successful.
Yeah.
Yep.
Did I miss anything?
No.
Yeah.
Impulsivity.
What? Yeah, right. That was an impulsive way to bring that up.
So thank you so much for joining us, Dr. Hierlihy, and giving us such a great summary of ADHD. And if you like this video, please like it, subscribe to our channel, share it with someone that you think may benefit from this information.
And Dr. Hierlihy, thank you so much. And as you said, you are in charge of your own health.
We'll see you next time.